Dr. Ackerley, thank you so much for your presentation. We enjoyed it thoroughly. We have a couple of questions for you before we let you go and move on to the roundtable portion of the day. And would you be willing to give us a little bit about, tell us a little bit about your background and where you're from, what your practice consists of generally?
Sure. I'm originally from the East Coast, from New York, and I've had a lot of very traditional education. And I'm boarded in neurology psychiatry. You know, I had started practicing integrative psychiatry a while back, last decade, primarily because I felt that medications were really overused in psychiatry and not particularly effective. And actually the research bears that out, that antidepressants are no more effective for most depressions than diet and exercise. So I was working with more functional medicine, integrative medicine, and I began to start attracting a number of patients who said they had mold illness. So other physicians in Arizona were treating mold and diagnosing patients with mold. And I have to tell you, I'll be honest, when I first saw the first few people who showed me all these labs and talked about their mold and having to stay away, I was more traditional and was thinking I was looking at somatization disorder. I thought it was probably psychiatric because I knew somehow that mold was okay, so therefore the patients weren't. And that is a traditional attitude, is, you know, we question the patients, not ourselves. But I kept getting these patients, and the labs are abnormal. I don't know what they mean, but the labs are pretty abnormal. And then I had one patient who kept really pushing me. People were seeing me because they had depression and hormonal issues that weren't being handled by the other physicians as much. And I started reading Surviving Mold and started learning a little bit about these abnormal tests. And then, interestingly, the first patient I treated was, and watching how these other people were being treated, I got the word cholestyramine. I had a patient come to me who I'd known for a while. She was seeing me for depression and a tremor. And she was really late for an appointment one day. And she knew exactly where the office was. She was lost. She got there half an hour late, and she'd been coming for years. Okay, and I said, what is going on? She said, I'm really clouded. She said, all this, I have rashes. I just had to see a doctor about my rashes, and my stomach hurts, and I have diarrhea, and my brain just is not working. I can't remember. I'm lost everywhere. And I'm thinking she's driving around. I said, well, what's new? I mean, we live in Arizona. What's going on? And she said, well, they're remodeling my house and they found mold and they're pulling out boards. And I'm thinking, mold. Okay, and she's very different than how I know her. So I said, do you think you might have mold illness? And really, we read these list of symptoms together in Surviving Mold. And she said, ice pick pains. I have ice pick pains, you know, and foggy brain. And it's like, yes, we have very foggy brain. To be honest, she was so clouded, I thought I'd have to call her sons about dementia. It was that bad. So decided to try cholestyramine. It didn't look dangerous. A lot of other people walking around drinking these things. And so 3 weeks later, she remembered the route. She was here. She was clear alert, felt fine. And I said, what happened? Different person. Kind of like that person I was talking about with VIPs. 'Cause she really did look more like she was going into dementia. And there she was, clear. So I took that cholestyramine and my rashes are getting better. The diarrhea stopped, and I was really hooked, because there's nothing I knew in psychiatry that was going to get somebody who is lost and, you know, clouded, and, you know, I didn't know anything except start to follow them for dementia and think about Aricept or treat that depression more aggressively than I had been. So I started to learn more, and then I, you know, had a few other patients I were treating that I was calling depressed and was getting a little upset that even though their depression and anxiety was better, they were still fainting, had diarrhea, had no energy, kept calling me about their damn diarrhea. And I was said to this next patient, who I think you saw at the conference, do you think you might have mold? They had a lot of mold, and that was kind of the start, because already I was having more success with these patients with depression and maybe dementia than you usually see in psychiatry. So, and that's why I encourage people who are psychiatrists is to take the time to learn some of this, because I can assure you, you are seeing many, many patients where inflammation is the predominant cause of what you're calling depression and anxiety, and it's fueling bipolar, and it's contributing to dementia. And if you can learn that and just even ask the simple question, Do you think you might have mold? You're going to start to get a lot of people better instead of just reaching for the latest drug that you've read about or heard about at the last conference and trying it, throwing some trial packs at the patient and seeing if they get better. So that's my story with why I do this, is it works.
Thank you very much. When you decided to certify, have you found that to be a positive part of your practice now, being a part of the Shoemaker certified physicians?
For several reasons. One, when I said I'd certify, I had really no idea what it was, but I decided I'd do it because I still was intrigued and I wanted to learn more. And it's turned out to be a very positive experience in meeting other physicians who think the same way and looking at a body of patients where I know what's going on with everybody. I know I don't know some of this stuff, but I do have enough tools and critical thinking to start to do things like look at why some patients react so poorly, others do so well, and there is so much room here for research and interest that I'm very, very excited.
How has it affected your practice?
Realistically, there are a lot of people with this illness, and it can overwhelm you unless you're prepared for the fact of how many people know they have mold, think they might have mold, and really want to get treated. So in terms of looking for practice revenue or anything like this, this is incredible, but there are other aspects to having a number of patients who really do need your services, not enough physicians doing this, and really wishing there were other physicians who could handle some of the easier patients.
Great. Well, we certainly appreciate you making the trip from Arizona today.
Okay.
Thank you.
Thank you very much. Bye.